Okay, so we're going to discuss today about the cytokines. Okay, so basically our cytokines are soluble protein that is primarily produced here by the different cells in our body that would try to regulate here both our natural or the innate immunity and our acquired or adaptive immunity. To serve here as a chemical signal, primarily regulating here the number one, regulate the cell growth of other cell for its own. Could also be responsible here for the proliferation, differentiation of another cell, and of course here the gene expression of the different other cells. So what trigger our cytokines here to be activated can be in the form of your bacterial lipopolysaccharide among gram-negative bacteria. Could also be the flagella or could also here other bacterial products. Okay, so your cytokines helps our body, but overactivation of your cytokines can eventually lead to your cytokine storm that can result here to your shock, to your multi-organ failure, could also be resulting here to death of the tissues or the body of the patients. Okay, so we have here the characteristics of your cytokines. So your cytokines try to act here on the cells within our immune system and even your outside your immune system. So another one we have here your pleiotropism. So pleiotropic here is actually the characteristics of your cytokines, wherein one cytokine would have a different receptor. Like for example, the T helper try to produce interleukin 2, and that interleukin 2 can pwede siya mag-act to your T cell for differentiation of that, can also act on the B cell for the differentiation of that, could also act on our NK. Mean to say this interleukin 2 has a different receptor with your T cell, with your B cell, with also your NK. So that's your pleiotropism or pleiotropic. Redundancy naman, so primarily, this is characterized here by your cytokines. There are several cytokines, okay, but they have only one receptor. Okay, like for example, your interleukin 2, interleukin 4, interleukin 5, okay, they have a receptor for your B cell that can facilitate your B cell differentiation. Synergistic naman, so again, they try to combine your cytokines in order for that to have a greater effect or activity. So like for example, interleukin 4 and interleukin 5 primarily help here in order for you to synthesize your IgE. Antagonistic naman, so they try to inhibit activity of one another. Like for example, interleukin 10 try to inhibit here the production of your gamma interferon. Or it would have your anti-proliferative activity against our gamma interferon. Okay, so we can divide our cytokines here. So we have your cytokines involved in your natural, the innate immunity, and we have also cytokines which are involved in our acquired or adaptive immunity. So first we have here your cytokines involved in your natural, the innate immunity. The cytokines which are involved in our natural, the innate immunity are responsible here for the manifestation of your inflammatory process. Responsible here for the manifestation of symptoms of your fever, headache, pain, swelling, or cellular infiltration in your damaged tissues. So the cytokines involved here in our natural innate immunity includes here the interleukin 1 superfamily. We have also here your tumor necrosis factor alpha, interleukin 6. We have also here your chemokines, transforming growth factor alpha, transforming growth factor beta, and we have also here your alpha and your beta interferon. So first, we have here your interferon. We have your interleukin 1. So interleukin here is a group of your cytokines wherein that one is being produced by your lymphocytes which try to act on another lymphocytes. Interleukin 1, we have here the interleukin 1 superfamily, primarily made up of your interleukin 1 alpha, interleukin 1 beta, and we have also the RA, that's your receptor antagonist. Interleukin 1 here produced by your monocytes and your macrophages. So we have here the difference between your interleukin 1 alpha and your interleukin 1 beta. Okay, so interleukin 1 alpha is primarily found on the cell surface of your monocytes and macrophages. Whereas your beta, on the other hand, is being secreted. So, pinapalabas siya. Ito ay nasa surface. As with the function, interleukin-1 alpha here, primarily, when it dies, it tries to serve as your attractant with your inflammatory cells in order to sense here that there is an injury on that particular area. So, kung saan siya namatay, it try to attract here your inflammatory cells to be attracted on the site. Into say may kalaban sa site na yon. Interleukin-1 beta, on the other hand, this is the one responsible here for the pinaka-function ni interleukin-1 natin. So, this is responsible here for the signs, symptoms, and activity of interleukin-1. This includes here, number 1, okay, try to induce here the fever. Second one, it try to attract here our phagocytes towards the tissue injury, and also as part of your inflammatory process, also try to activate our acute-phase reactants. So acute-phase reactants are soluble substances primarily present or increases its level when you have an inflammatory reactions. Okay, the RA receptor antagonist, on the other hand, is part of interleukin-1 wherein it try to keep the balance between your interleukin-1 and interleukin-2. So, serve here as your negative feedback. So, pag sinabing negative feedback here, pag hindi mo kailangan, it should shut down here the production of your, or the activation of your interleukin-1. But if your body is needing, for example, here interleukin-1, then it should activate here the positive feedback. Okay, as with the function of your interleukin-1, so number 1, it try to serve here as your endogenous pyrogen. Pyrogen, so fever-inducing. So if you have your fever, if you have your infection, so fever is one manifestation if you have your inflammatory process. Another function of that, it try also to induce here the proliferation, production of your cell adhesion molecule, your chemokine, interleukin-6, which try to activate our T cell. And then finally, try also to produce here, induce the production of our colony stimulating factor. So colony stimulating factor is involved in our hematopoiesis that would allows the differentiation of your cells. Okay, the next one, we have your tumor necrosis factor alpha. So from the word itself, tumor necrosis. So this is cytokines which has been isolated before here from the tumor-infected cell, and this is responsible for the lysis of the tumor. Kaya tinawag siyang tumor necrosis factor. Okay, so this one is being stimulated primarily with the presence of your gram-negative infections, especially for the gram-negative bacteria, with the presence of the LPS component of the cell wall of your gram-negative bacteria. Its main function is responsible here for the vasodilation. If you have a tissue injury, diba? Vasodilate, increase capillary permeability, also induce here the expression of your MC class 2 and your chemokine. Okay, but overproduction or overactivation of your tumor necrosis factor alpha result to your septic shock. Manifested here by decreased blood pressure, decreased tissue perforation, and DIC. So, hindi maganda din ang overactivation ng ating tumor necrosis factor alpha. There are two forms of our tumor necrosis factor alpha. We have here the membrane-bound, and we have also here the soluble form. Okay, the membrane-bound is actually the one, okay, responsible here for itong mga manifestation ng ating tumor necrosis factor alpha. The soluble form, on the other hand, is derived from your membrane-bound by the cleavage of your tumor necrosis factor converting enzymes. So you need to cleave or to hydrolyze your membrane-bound in order for you to produce here your soluble form. At the same time, this one is short duration and unstable compared with your soluble form. Compared with your membrane-bound na form. Next, we have here also interleukin-6. Okay, the interleukin-6, on the other hand, would have here produced by both our lymphoid and non-lymphoid cells. For the lymphoid, we have here your T lymphocyte, your B lymphocyte. For the non-lymphoids, this was being produced by monocyte, your macrophages, keratinocyte. We have also here your fibroblasts. Okay, the main function of interleukin-6, so we have involved here in your acute phase reaction for the synthesis of your immunoglobulin or antibody, and another one for the activation of both your T and your B lymphocyte. Chemokines here serve as your, try to attract your neutrophil or your phagocyte towards the tissue site. So it acts here as your chemotoxins. Our chemokines is being classified according to the location of their N-terminal cysteine residue. So example of your chemokines, we have the alpha chemokines, we have CXC, characterized here by the presence of your 1 amino acid in between your first and second cysteine residue. Beta, we have here your beta chemokines or the CC, characterized by the presence of your 2 adjacent cysteine residue. C chemokines, on the other hand, characterized here by the absence of your 1 of the 2 cysteine residue. And we have your CX3C chemokines, on the other hand, that one is characterized here by the presence of the 3 amino acid in between your first and second cysteine residue. So another example of your chemokines involved in our innate immunity, we have here your transforming growth factor beta. So this one would have here proliferative activity, can induce proliferation, but some of its activity or effect here can also try to inhibit the activity or proliferation of the other cells. So among its function, it tries to regulate the expression of your CD8 positive from your immature CD4 negative, CD8 negative na thymocyte. Another one, inhibit activity of your macrophage, inhibit also your interleukin 12 and our gamma interferon. And another one, it try to establish here an immune tolerance in our mouth, okay, against the bacteria by activation of your T helper 2. Then we have your interferon alpha and your beta, both produced here by our dendritic cell. So this one is being called interferon because it's trying to interfere with our viral replication. At the same time, try to activate your NK expression of your MSC class 1 and also utilized here for the treatment of certain disorders like your alpha interferon is used here for the treatment of your hepatitis C, your Kaposi sarcoma, related to your AIDS. And we have your beta interferons involved here also for the treatment of your multiple sclerosis. Okay, then we have here the cytokines which are involved in your adaptive or acquired immunity. So the cytokines involved here in our adaptive or acquired immunity are actually cytokines produced or released by our T helper. So we have here the 3 subsets of the population of your T helper. So we have T helper 1, T helper 2, and Treg or T regulatory. Okay, so it starts here with your T helper 1. With your naive, the T helper acted upon by your interleukin 12, it will trigger the release of your T helper to release here your gamma interferon, and we have your interleukin 2. Okay, the gamma interferon is the principal molecule produced by your T helper 1. That's why it's involved in the following activity. Activates your CD4 positive and your NK. Stimulates also here the antigen presentation of your MSC class 1 and your MSC class 2. And also try to boost here the tumoricidal activity of your macrophages. Okay, another one, interleukin 2. So this is your T cell growth factor. So its main function here, try to stimulate the differentiation of your T lymphocyte, your B lymphocyte, and another activity of this one helps here your B lymphocyte for the antibody production. T helper 2. The T helper 2 here try to produce the following main cytokines. We have interleukin 4, which are involved here in the IgE production or the reagent. So again, the IgE is involved in your allergic reaction, parasitic infection, or the helminth or worm expulsion. Interleukin 10 is another one produced by your T helper 2. That one, however, has anti-proliferative activity against our gamma interferon. It tries to inhibit your T helper 1, and then it also tries to inhibit here the activity of your gamma interferon. T regulatory, on the other hand, would have your CD4 and CD25. So again, your Treg here try to maintain the balance to prevent your autoimmunity. So it try to stimulate here our tolerance against your self-antigen to prevent your autoimmunity, against your allergen, and could also be against our transplanted antigen. Okay, then we have also here the cytokines involved in our hematopoiesis. So first we have here the APO or the erythropoietin. So again, this is produced by our kidney. Primarily, we try to induce for the your colony-forming unit erythrocyte to be converted to your fibroblasts. That would eventually help here in your RBC production. Then interleukin 3 is considered to be your multi-lineage colony-stimulating factor. We try to induce your multi-potential stem cell to differentiate primarily with your lymphocytic series or the lymphoid cell lines. Granulocyte monocyte colony-stimulating factor help here in the differentiation of our WBC producing cell. Then we have your granulocyte colony stimulating factor, try to stimulate your granulocyte monocyte colony forming unit to differentiate to become your neutrophil. So it will induce this one to become myeloblasts and later on for the production of your mature segmented neutrophil. Monocyte colony stimulating factor try to induce your granulocyte monocyte colony forming unit to proliferate that give rise here to your monoblasts and later on become here your monocyte. Okay, for the differentiation of your basophil and then your mast cells, so it requires your interleukin 3 and granulocyte monocyte colony stimulating factor. And for the eosinophil differentiation, so we'll be needing here your interleukin 3, granulocyte monocyte colony stimulating factor plus your interleukin 15. Okay, so that's it for this topic. Okay, thank you.